Doctors/nurses, what was the most "how the F are you not dead" patient you dealt with? My second case, my best case ever. A young woman in her 30s had a stroke. She clotted off the basilar artery, the big artery in the base of the brain that supplies all of the primitive functions, like breathing and awareness. I found out about her a day after the event. This, by the book, is a hopeless case. She was literally already dead. But because she was young, they prevailed upon me to do something. I poked a catheter, a long, skinny plastic tube, into her groin artery, then snaked it up to the blocked artery in the base of her brain. I infused a clot-busting drug into the artery for about 12 hours, TPA. I rechecked, and the clot was gone. She woke up the next day. After a month, she literally walked out of the hospital. She sent me a nice card a month or so later. It bothered me that her handwriting was better than mine, even after the stroke, but I was pretty happy. Next story. During my EM rotation, guy had a road accident. Flesh wounds as deep as his intestines were out. Around 40% of his face was scraped off. One eye was out of the socket. The right forearm had ripped off muscles and you could see the bone. Now, the miracle is that the bleeding somehow had stopped, and when I came in, I saw his chest moving and him holding his intestines. I was like, yeah, wow, this guy is alive. We helped him, stitched everything back, the face was reconstructed, and now he's alive and well. Next story. Had a patient with an internal temp of 75 Fahrenheit. He was drowsy but fully alert and oriented. He was found in a river embankment in the middle of winter. He had been lying there overnight before he was found by a dog walker. We didn't believe the equipment when it told us 75 degrees, so we repeated with a rectal thermometer, then a different rectal thermometer, and then a rectal probe attached to the bedside of the Metatherm system. They were all consistent, and after several hours of heating measures, we got their internal temp up to 90 degrees before they went to ICU. The second "how the F are you not dead" patient was a person who had a blood sugar of 1800. They weren't in a coma, just a woman who walked in to complain about abdominal pain. Next story. When my son was a day old, the nurse came in to check on him. She couldn't get a temp, so she went and got a new thermometer, digital. Same as before, no reading. She was puzzled, so she brought him out of the room and put him under a heat lamp. After a while, his temp registered. They knew something was wrong. Tested his blood sugar, it was 2. It started to get very scary for everyone. Down to the NICU for the next 2 weeks. Turns out he has a genetic disorder called MCAD. His body cannot process medium chain fats. Long story short, he cannot fast. Ever. His body will use the reserves of sugar, but once they're depleted, he could crash and go into a diabetic coma. This is what happened the day he was born. He wouldn't breastfeed and didn't want a bottle, so we learned of this condition the hard way. The first 1.5 years of his life was tough, and he had to wake up and eat every few hours. My wife and I never had a full 8 hours of sleep for almost 5 years. We've landed in the hospital when he's vomiting from the flu many times. If he can't keep anything down, he must go on a sugar drip. But today, he's 11 and healthy, 5'8" and 155 pounds. Big, strong, solid boy. No long-term disabilities from the sugar crash. The condition has never presented again, but we do make sure he always has enough calories. My only concern is when he's a teenager or young adult. Fasting during a hangover is okay for most, but not him. Next story. We had a patient come in after mowing the lawn. Patient said something was kicked up by the lawnmower and hit him in the head. Didn't think much of it. Finished cutting the grass. Still had a headache a few hours later, so came to the ER. We CAT scanned his head, and there's an entire nail embedded in his brain. He had the tiniest abrasion to his forehead and no neuro deficits. He had no idea. Everyone was absolutely dumbfounded. Yeah, so this one sounds like a medical miracle for sure. To have that embedded into your brain, how A, are you still alive, and B, no cognitive impairment. That is really impressive. Next story. I used to work in obstetrics in the preemie ward. I've seen some extremely premature babies that look like they were barely hanging on. Tiny head, maybe 2 inches from chin to top of the cranium. Purplish/reddish translucent skin that looks paper thin. Eyes closed, not responsive, limbs smaller than a finger, and always extremely skinny. They often face lifelong problems due to being born so premature. I remember once asking the doctor why we even bother at that stage, since it looks so hopeless, and in some cases is, frankly. She said, and I remember very well, the preemies that were hopeless cases 20 years ago now live normal lives, so that's why we keep on pushing. Next story. My ex-boyfriend is a ski instructor. He told me that one day all the slopes were extremely icy and many people were coming in with injuries. He had fallen badly and returned to the ski lodge. He was checked out and said he felt fine. Fortunately, a paramedic happened to be looking at him when his helmet swung open on the side because it was very badly cracked. They took a 9-year-old girl with a broken femur off a stretcher and put him on it and took him to the hospital immediately, where they found he had broken his neck and needed immediate surgery. Amazingly, he's mostly fine, except for now having acid reflux for some reason. Next story. Not me, but my mom was an ER nurse right after college. A family got in a car crash and there weren't any serious injuries. They were just taken to the ER to be assessed. They had a baby and my mom was asking them questions about its health, etc. When she asked what the baby was being fed, the mom said, juice. Just juice. She had heard that at 6 months you can start feeding the baby juice, not realizing it was juice in addition to baby food or milk. This woman had been feeding her baby only juice for months. Next story. We once received a patient that was bitten by a rattlesnake. Twice. He only managed to get to the emergency ward 3 hours after being bitten. Then, to make things worse, we only managed to get the correct antivenom flown in 1 hour after his arrival. He now works at our hospital as an admin clerk and is as healthy as ever. Next story. We were the closest hospital, so they brought a civilian in, former AF medic. His safety gear failed, and this guy fell 128 feet from a communications tower. It had rained the night before, and he fell into a marshy puddle of high grass, flat on his back, concussion and whiplash. No broken bones, but the bruises that covered his body from head to heel were something to behold. He spent a week in the hospital before he could move comfortably. Next story. While a student did a clinical placement at a major trauma hospital where they kept a collection of x-rays you never usually see because the injury would typically kill the patient instantly. Most interesting was a smashed pelvis from a jockey in a horse racing accident. That kind of injury would usually also result in rupture of femoral arteries, which means you bleed to death very quickly. But somehow this guy survived and made it to hospital and lived long enough to get x-rayed. I don't know if he recovered though. Next story. I'm not a doctor or nurse, but the doctor who saw my mom said he had no idea how she was alive. Years ago, my mom was having gastrointestinal problems. She had incessant stomach aches and was bound up something awful. After 3 days of not being able to poop, she went to the doctor to get checked out. After a thorough examination, the doctor determined that her gallbladder needed to be removed immediately. The next day, after the surgery, my mom comes to and sees the doctor standing over her, and he wasn't happy. "Your gallbladder was dead," he said. Like dead. In fact, it was completely gangrenous. Had you waited another day to see me, you would have died. Had it ruptured during surgery, you would have died. That was the worst, most stress-inducing surgery I've ever had to perform in my 20-year career. No offense, but I hope I never see you again. And he walked out of the room. Next story. I had a hemorrhage I didn't know about. I had seen some blood while wiping that was a bit more than I chalked up to wiping too hard. Went to a physician and he checked my anus and told me I had hemorrhoids that I probably agitated. Recommended I use baby wipes in Preparation H. Well, 2 days later, I'd started feeling very nauseous with a nasty headache. I slept right up until it was time to go to work, and so decided I shouldn't call off. About 5 hours into my shift, I go to take my break and use the restroom. The moment I pushed, I passed out and fell off the toilet, to be found by my coworker however much later. EMTs are loading me up and start taking my vitals. My O2 levels are low AF, and when we got into the hospital, they rushed me through the back and into a room. They say I need blood, pronto, and I remember passing out again. The next thing I woke up to was an RN throwing my curtain open and shouting, "Why the F isn't he hooked up yet?" Apparently the ball was dropped somewhere between getting my blood type and the blood dropped off. So I sat there for over 45 minutes needing blood, and that RN was madder than hell. Finally, I get hooked up, and I took 3 pints of blood, stayed overnight, and needed another pint by the next afternoon. Hemorrhage was found, microsurgery performed, and I've been fine ever since. The same RN came to see me after my surgery and told me she was terrified I was going to die when the EMTs handed over my vitals when dropped off. Next story. Not a person, but when I was a kid, our cat went out with 4 legs, then just strolled back home, not showing any signs of anything being wrong, with 3. No blood. Emergency vet didn't believe my mother when she called, but agreed to see her anyway. Surgery the next day to do whatever to stitch the hole. She lived happily as a 3-legged cat after that. I know that cats are nimble and agile and flexible, known for having 9 lives, but I'm just trying to envision how they're able to get around. I guess if it's one of their front legs, it's not as big of a deal, but man, that sucks. Hate that for the kitty. Next story. Not a nurse, but this is a cool story. My dad has a blood condition that makes him prone to clotting, and it sent him to the hospital several times now. The most recent case was this. He had started doing nightly runs, raising money for a charity, and every time he came home, he'd be more and more puffed out with a really sore leg. He mostly just thought it was muscle cramping until at one point, my mom just told him to check it out in the doctor. Doctor almost immediately told him to go to hospital as soon as he described it. Hospital took him in, sent him for an MRI, I think, and in the nurse's words, they stated it was the largest blood clot they ever saw in a person that was still breathing. So that was a fun week. Next story. I have a few that stick out in my mind aside from hospice patients who have hung on for a surprisingly long amount of time. First was a patient in third-degree heart block with a pulse of 30 at best, sitting up and talking like nothing was wrong. I was a new nurse at the time, and that freaked me out. Basically, the electrical system in the heart was malfunctioning, and this person was flirting with a massive cardiac event. Then a lady with a hemoglobin of 4. It should be at minimum 12. She was whiter than the bed sheets. It was really unsettling to see a living human that color. Finally, I had an alcoholic patient, blood alcohol of 0.4 something, and they were conscious. They drank a handle of whiskey a day. I was concerned, impressed, and surprised at the same time. Next story. 18 years ago, I went into the ER to get a cyst lanced open. 3 weeks later, I felt pain in my back. I went back to the ER and they found nothing, only did x-rays. I felt weak leaving, so went home and crashed on my couch. I woke hours later and tried to get up and fell. I went down fast. I called an ambulance and went to the hospital. I sat for 6 hours until finally someone came to check me out. I had a 105.0 fever. They immediately rushed me into an MRI, and lo and behold, I have MRSA inside my spine. I was rushed into surgery and now live from a wheelchair. T5 to T11, I'm fused. The doctor said if I waited one more day, I wouldn't be here. I did 16 weeks of Vicomycin through IV, 3 hours twice a day. I'm truly lucky to be alive today. Next story. The first time I witnessed a pulseless VTAC patient. VTAC equals ventricular tachycardia, one of the worst things your heart can experience. He probably did have a pulse and was just super weak, but we couldn't feel one. The guy was awake with no complaints other than being cold. He was pale as I've ever seen a human, and he was that way for 2 hours before we got a cardiologist in. We cardioverted him a few times, similar to using a defibrillator, but has some specific criteria. Even though we couldn't feel a pulse, he was awake, so we followed modified advanced cardiac life support protocols. But didn't want to sedate him too much with Advian because, well, it's better if he didn't go to sleep, lol. We all hovered around his room, awaiting for him to pass out, finally, so we could start CPR, but nope, he just kinda hung out, watching Wheel of Fortune, waiting to literally drop dead. Next story. I'm not a nurse, but I did work as a stock tech in the critical care OR at the hospital I work at for a while a few years back. I heard the call come in, and all of the staff rushed to prepare a room for an incoming patient. When they came in off the elevator to the life flight landing pad, I saw this kid, probably 16-ish, get wheeled in with paramedics completely surrounding his head in particular. I figured he just had some sort of severe laceration they were trying to keep from bleeding, as there was a lot of blood. They took him into a room, and I followed with a feeder cart. That's when I saw his head, or more accurately, what little was left of it. Basically, the entire front half of his head was completely missing. Eyes, nose, jaw, tongue, forehead, everything. The nurses around his head were desperately trying to hold his brain in while he was intubated. Apparently, he had attempted unaliving himself via shotgun to the chin. The worst part was, he was still alive. He was groaning, gargling, wiggling his hands and feet, and it seemed he was still very much aware of what was going on. I had to move on to other areas of the unit, so I'm not 100% sure what happened after that. But I seriously doubt he survived much longer after that. I can't even imagine what that must have felt like. Poor kid. Next story. As a lab tech, I had one I dubbed Everything Guy. He was complaining of a sore stomach after coming home from overseas, so got the usual "what were you doing" questions. He was in West Africa, didn't bother to get anti-malarials, no vaccines, admitted to eating bushmeat. Also said he thought it was undercooked, drank water from a local source. Turns out this was directly from a river, without filtering it. River was apparently badly polluted. Hired prostitutes while there, didn't use protection. He basically saw everything you shouldn't do on holiday and used it as a checklist. Yeah, it's one of those things where, like, even making one of these mistakes could result in, like, life-altering consequences, and he just casually did all of them. Smart guy. Next story. Not a doctor or nurse here. I'm a lab tech, but when I worked at a hospital in Connecticut, we had a patient come in complaining of weakness and dizziness. The nurses told us later, we ran a test called a CBC as the doctor ordered. The hemoglobin was 2.8. The patient should have been passed out hard, but no, I was told she walked in on her own. Edit. To further the story, in doing the CBC, our machine wouldn't calculate the hemoglobin because it was so low. We had to use our blood gas analyzer to get a result. It was that low. Next story. We had a patient, an 18-year-old girl, who was in a bad car accident. She was literally split from the chest to pubis by the accident. Somehow, we stitched her back together, though we thought infection would likely claim her. Nope, after 6 months with lots of antibiotics, she walked, and I do mean walked, out of the hospital. Next story. Did you know that part of the natural instinct to hold a stillborn child to your chest that there's very unlikely chance of the baby waking up? I was at a press conference years ago about the only kid in decades that lived through it. Like, pronounced dead and started breathing in mom's arms. It's pretty common for preemies to be given to the mother to hold, for closure and whatnot, and mom gets told they might spasm a little, it's just nature. There's a reflex for babies to do it, to seize and grab for air, and parents can mistake it as a sign of life. Yeah, little Lazarus, that's his actual name, managed to use this stupid evolutionary development to live. He was legit declared dead and still lived. Next story. The CPR algorithm changed about a decade ago from ABC, airway, breathing and circulation, to CAB, circulation, airway, breathing. This means that instead of opening the airway, giving rescue breaths first, we begin doing compressions first. The first time I used the new version was at a witness to rest. I happened to be at the bedside when the rhythm changed and was therefore able to start treatment immediately. The patient became unresponsive, pulseless, and the rhythms showed ventricular tachycardia. I began chest compressions, and the patient raised their arms and tried to fight me. Confused, I paused and checked a rhythm, pulses, and assessed their alertness. The rhythm was indeed pulseless ventricular tachycardia, and they immediately rolled their eyes back and went limp. I must have gotten on the chest so quickly that they hadn't had time to lose brain perfusion. It's never happened since. Next story. Back in my surgical days, resident on my trauma rotation, really nice young guy comes in via EMS. He'd been working on a factory site doing work high up on a tower, I think 80 to 100 feet kind of deal. Was climbing his way down, about halfway when he hears commotion overhead and someone shouting, "Watch out!" He's on the ladder, so can't do much, but bows his head to cover it. Feels something strike the back of his neck, manages to stay calm, reaches around and realizes it's a large piece of metal that's embedded in him. His medic training kicks in. He calmly climbs down the rest of the ladder, sits down and asks someone to call an ambulance. I wish I could upload the photos I have. It's a wrench, 36 centimeters or 14 inches long, but the non-wrench end is a pointed pickaxe-type tool, and that's what's embedded in him, nestled nicely against C3 and C4, middle of the neck. All we can get is x-rays, too much metal artifact for a decent CT. Can't see any fractures, fully intact neuro exam. Rock star of a spinal surgeon just decides to yeet it out. Few stitches, soft collar for a week, and guy's back to normal. Great story. Glad to hear that he survived. I'm also glad that you did not upload photos of that. I'll take your word for it that it really happened. Don't really need to see a wrench embedded in a guy's neck. Thank you. Next story. A friend of mine was feeling crappy for days. He'd go to work, feel exhausted, come home, sleep 13 hours, repeat. Finally, he got to feeling so bad he decided to go to the ER. He drove himself around 3 a.m. He got out of the car and the security guard said, "Oh my God," and ran to get him a wheelchair. ER admission said, "Oh my God," and got the ER doc. ER doc noted my friend was quite yellow. They ordered blood work. When it came back, the ER doc didn't believe it and had it done again. When the second round came back, the doc asked my friend for the next of kin information. My friend said, quote, "You can't call my mom, it's 4 a.m. And the doc says, "Your kidneys have completely failed. We're going to send you upstairs and give you a pint of blood and an hour of dialysis. And we need to know who to call if you still don't make it. You should have been dead a month ago." He got a kidney from his sister and is still doing well today. Apparently the kidney was as close a match as one can get, and he should live an essentially normal lifespan. Next story. Not me. My wife works in radiology. A guy came into the ER and was looking a little pale. He was coughing a bunch as well. Doc sent him stat for a chest x-ray. Note that this guy was mid-40s and appeared in pretty good health. As my wife was scanning him, he started to look a bit more blue in his hands. She kept asking if he was okay, and he assured her he was fine with perfectly normal responses. She was the only person in the room with him at the time. He stopped coughing and seemed all right. The second he was done with his scan, he thanked her for taking care of him and he was ready to go home. She was looking at the scan with a holy crap face because his lungs were completely clotted up. Of course, as a tech, she can't say crap to the patient. She had that "how are you alive" thought. He dropped to the ground and started spitting blood. My wife immediately hit code blue, and emergency staff rushed in before she had to try and administer first aid herself. He was instantly dead. Pulmonary embolisms that just dropped him right there. Next story. I had a patient that was already blind from diabetes, lost some toes, part of a foot. I checked the blood sugar and it's 45. This is Canada, so your normal range is 4 to 7. Check it again, 45. This patient had no symptoms of hyperglycemia. He just took his insulin pen, cranked it, and self-injected. Home care. Had to wait around a bit to see what would happen, but eventually we left, and he ended up being totally fine. Most home glucometers don't go past 30. I was with my trainer nurse who was dumbfounded. Next story. Not a nurse or doc, but a doctor said this exact thing to me. 18 just received delivery on a new motorcycle. Rolled out of the dealership. A B double driver had fallen asleep and drove through the highway barrier into the service road, which I was on, and then into me. I saw it coming and braced, somehow survived. About a month later, I took delivery on my second road motorcycle to promptly get rear-ended at a red light by a drunk driver. Then, at the end of the year, I got into an abseiling accident where a poorly anchored sling had dislodged and added additional rope to the line and jarred my back. Got to the hospital, same doctor again. He straight up said, "How the F aren't you dead, and why are you back?" Next story. I had a patient I just delivered. We pushed for 4+ hours before ending up in a C-section. We get back to the room, and I push down on her belly to check the bleeding. It was a little excessive, so I call for the doc. He came in, minimal bleeding, because that's how it goes. The blood pressure goes off, and it's in the 60s. I do another fundal, and had just non-stop tennis ball-sized clots coming out. Luckily, the doc was at the nurse's station and someone showed him the blood pressure. He comes into the room as I'm doing the fundal and immediately calls a massive transfusion protocol. We end up in the OR giving her so much blood. He placed a tamponade balloon, and we go to PACU to finish the recovery. It's just me and one other nurse. Everything is going well for a bit, but then there's more bleeding than normal in the drainage bag. Her lips are blue, face is super white, and the blood pressure read in the 50s. The doc sends his resident to check it out, who says it's fine and to give more blood. I ended up calling an anesthesiologist and asking him to come assess. He was known for being rude, but he came in there and immediately called the OB and yelled at him to get in there immediately. I had a lot of respect for him after that, and was really grateful he hadn't blown me off. I still don't know why he didn't blow me off when I called him. We end up back in the OR and she ends up needing an emergency hysterectomy. The doc described her uterus as being a paper bag. I came from ICU, step down, and was used to patients that looked like crap, but I really thought this lady was going to code and die. It ended up she lost like 3 liters of blood, was intubated and in ICU for a few days. I never went to go see her again because I was so mortified by what had happened. I was newer to labor at the time and kept feeling like I made a mistake somewhere. Next story. Walked into a room to take temp. See young guy on vent, OD, and I say, "What's up?" And he gives me the nod. Did my stuff, and outside, the doctors are rounding in the hall, so I sit down to key in vitals, and overhear docs discussing treatment and saying no response. No brain activity, so I asked, "Are you sure?" And this lady resident goes off on me about him being brain dead. No chance he'll recover, yada yada yada. I just sat there embarrassed and took the verbal abuse from the resident. Next day, come in for my shift and the PT is gone. He had been weaned off vent and had been transferred to step down. So I wanted to say I told you so to that female, pitbull, resident, but took professional route and let it go. PT ended up walking out of hospital 100% recovered. Next story. Ooh, I have one. I'm not a doctor or RN, but I work in healthcare. I take ultrasound pictures of people's hearts. I put my probe down on a middle-aged lady in the ER. I thought my machine was on frozen and went to unfreeze the picture. Turns out her heart was barely beating and it looked like it wasn't moving. She had walked off the street and felt out of breath. A normal heart injection fraction, how well it's squeezing, is 55% and up. Hers was about 2% of that. Because it was barely beating and blood wasn't moving around, the blood started to clot together. It made a huge clot. It was an easy 6 centimeter by 5 centimeter. For reference, a female heart is considered to be dilated at 5.3 centimeters. So the clot inside the heart was bigger than a dilated heart. It was bad. I honestly have no idea how she was able to walk around at that point. Next story. When I was 30, I survived 2 episodes of ventricular fibrillation before they figured out what was happening and put a defibrillator in my chest. When they put the ECG on me, after the first episode, they thought the machine was broken because my heartbeat was so irregular. The second episode was caught on an implanted monitor. The next day, when they downloaded and read the results, the technician thought his machine was broken. Then his face froze and he said, "Don't worry, everything's fine." As he ran out of the room to get the cardiologist, I yelled back that, quote, "It seemed like everything was not fine." I had a defibrillator implanted about an hour later. I've had 3 ablations since then, and so far I'm still here. Next story. Not a nurse, yet, but I am a nursing student and a nursing assistant at a hospital. We had a patient who came in with a blood clot in her leg from overdosing on heroin, and passing out/overdosing in a position where her leg was pinched beneath her. She was presumably found after almost 2 days, somehow still breathing. The clot in her leg formed while it was pinned awkwardly beneath her. This patient was with us for almost 6 months. Normally, patients are there for about a week, give or take a few days. During the 6-month day, she was losing weight drastically as she refused to eat. Her hair was matted and had to be cut off after many attempts to comb out the matting. She was probably 5'6" and was now down to 90 pounds. She refused to participate in her physical therapy almost every day. She just didn't want to get better, but was also very manipulative with the clinical staff, only wanting pain medications but refusing to even have her vitals taken. Physical therapy pushed every day, and some days were successful in getting her out of bed. After she was strong enough to walk with a walker, and the blood clot had been treated, she was discharged to a shelter downtown. Within 24 hours, she went to the ER at another hospital, and they sent her back to us. There she stayed another 8 months, with her same old ways, refusing care and not eating. By the time she finally died, she was 68 pounds and had basically starved herself to death. She refused feeding tubes. Basically, any help the clinician suggested, she denied. I don't think she would have even lived that long if it weren't for the IV fluids. She was seen by a psychologist many, many times and would refuse their help as well. She looked like death from the moment she came in. I just couldn't believe she was a resident at our hospital for over a year before she finally passed away. Next story. NAD, and I don't know, this was notable at all, but I have a spinal cord lesion at C1, another at C5 and 6. It didn't strike me as anything strange, really, until my neuro mentioned offhand how lucky I'd been when I asked him why. He explained that C1 lesions are often fatal due to how they impact breathing/autonomic and all functions below. But my non-traumatic injury stopped with only minor breathing restriction and movement sensory deficit as impairment. Then I went and read up on lesions this high, and understood I was pretty close to just dead. When I asked my doctor what lesion meant in my context, he said severed, and even though the C5 and C6 is much more impactful, the C1 is scarier. Next story. My dad broke his neck in high school playing football. Immediately he couldn't move. His friends moved him, which is about the worst thing you can do. Moving him almost killed him, but they got him to a hospital and fused his vertebrae. He almost died in surgery as well. They told him he wouldn't walk again. He gave them a big FU by walking out of the hospital a couple months later for prom. Next story. I work in the public health field, and I've had a few patients to track down that I honestly had no idea how they survived. One had a laundry list of issues: Hep A, B, C, endocarditis, mitral valve messed up, AIDS, abscesses, disseminated MRSA in their bloodstream. I was required to gown up, mask, gloves, whole 9 yards just to be in the room with them, and I quickly found out they were in no state to answer the questions I had. I find out later they were transferred for open heart surgery to a different hospital after, no lie, attempting to check out against medical advice, AMA. At hospital number 2, they've completed surgery, and finally are somewhat on the mend. Their parents checked them out, again AMA, to make the multi-hour drive back home. I was flabbergasted and sure, no way they'll even make it home. And lo and behold, they crop up again in a public health investigation, a year later, alive. I was shocked they had survived that long. Next story. Not as bad as most of what's here, but I'm a sleep tech and I had a middle-aged patient whose oxygen fell all the way down to the 40s and was having central apneas for over a minute. He spent more time not breathing while asleep. No wonder he complains he feels dead every single day. I couldn't believe it, so I tried a bunch of other oximeters in different hands and fingers, and they were all incredibly low while he was asleep. Next story. Obviously, this could get real gross. My anecdote includes skin picking, heroin, meth, and lots of other fun factoids. I'm not a medical worker, but my sister was an IV drug abuser for over 15 years while usually homeless. She ended up in ICU the first time in 2011. She had fallen and broken her coccyx, so they had to remove it. However, there was a pressure ulcer around the area that was 14 centimeters diameter and about 3 inches deep. I have no idea why one is metric and the other is imperial. You'd have to ask the occupational therapist. Additionally, she had lost antagonistic movement in both of her arms. She could make fists but had trouble opening her grip. This was because she dug out all the skin on both arms over several years. She had picked so much you could see the ulna and radius on both arms. There were these huge areas. Her arms are still like that, but the skin has all grown back and she even regained some neurons. The body is effing amazing. The bones are still visible under the skin. All the muscle really is gone. And of course, she was starving and malnourished. She was 32. She's 2 years older than me. She was in ICU for a while and in the hospital for 3 months altogether. That time. The issues didn't end with all the above. She still had a debilitating heroin problem, and when you're an addict in the hospital, they just give you opiates and stave off withdrawals. They're not interested in forcing anyone to get clean during treatment. The pressure ulcer was bad enough, the surgeon wanted her to get a colostomy to temporarily redirect bowels so the large wound on her back could heal. If she was pooping from her butt, it's impossible to keep it free of infection from being so close to the wound. It took a lot of convincing. The surgeon was doing what was called a flap surgery. He moved a muscle from her butt to her lower back so she'd be able to move properly again. He did really great work. He was one of the best plastic surgeons in Colorado, and he did her a sincere kindness. He also looked like Gary Busey and had a great sense of humor for a surgeon. We would go through bouts of speaking or not. She had felony charges and warrants, but that colostomy ended up being a blessing and a curse. No one wants to deal with you, which is a form of discrimination most people are unaware of, even though there are people who live with this kind of thing for life. When she'd get arrested, they would take her to the hospital as soon as she started withdrawing. She tried to get rehab through Medicaid, but it was hard to get facilities to accept her. They said the bag made her not medically stable, but for the next few years, she really started trying, with lots more ICU and relapse. I didn't speak to her most of the time, but she always listed me as next of kin, and I always showed up. In fact, I had to stop showing up because at one point in 2012, she seemed to start going to the ER just to get me to show up. But there's a difference between getting a text from her versus getting a call from a doctor from an ICU. The hospital tried to pull this shtick where they could reverse the colostomy, quote, once she was clean, and I know that sounds like a good deal, but the bag was prohibitive enough as to hinder recovery. She eventually convinced the team who gave it to her to reverse it. In 2013, she was back in ICU and nearly dead. She had suffered heart failure. She never OD'd. The heart failure was from picking up a habit of putting off or selling her methadone dose and then smoking meth with her boyfriend, or some combination of bad choices. On this trip, I had our dad fly out from the East Coast because I was sure she was not waking up. She woke up. The next time I got that ICU call was 2014, and the doctor had a very pointed conversation with me about getting her to sign a DNR. But as much as all the evidence suggests she wanted to die, she didn't. This was the second heart failure ICU stay. She was always really nasty to most of the medical staff when she came out of comas. This happened 3 times, the coma thing, before 2015. So before that last ICU stint, we hadn't been speaking, but that was what she wanted the outcome to be, and I reluctantly lined myself up like Charlie Brown to her Lucy with the football. She had been living with a roommate, therefore getting out of chronic homelessness, but her means of acquiring capital were still dubious. Pretty sure she was pimping. That's another story. But she's clean in so much as she's sticking with methadone. Believe me, when a loved one nearly unalives themselves repeatedly over drug abuse, you take what you can get, and for a decades-long user, you have to find something, anything to stop the abuse cycle. It's liquid handcuffs, but it beats some alternatives. My opinions on opiate treatment are another topic. In 2015, my sister tells me she's pregnant at 36 years old. She stops all prescriptions, even stops smoking weed. She's been a little heavier for a while now. No literal heroin for over a year. Still on methadone, etc. She went to rehab for pregnant homeless women. She was the oldest one. I lived in one of the most expensive cities in Colorado, and she found herself a room at another program for pregnant homeless women. She delivered a healthy boy. At first, she gave the welfare system a try, and it worked. She got to live in that nice city, and it was a good thing because her daycare referred him to get screened for autism around 2. These bougie little cuties tend to have really great early intervention. And now she's working as a bookkeeper for a major national vehicle manufacturer, lives independently, making a bit too much money for welfare. She's part of an infinitesimally, vanishingly small percentage of both chronically homeless and opiate users. She's still got issues. I wish she didn't have a kid, but that isn't his fault. She got clean and started making a lot of much better decisions. But I will probably always stay at arm's length. She still pulls the Lucy with the football crap, just in different ways. But she should have died countless times, and I said goodbye a ton, only to have her keep going on. When the first ICU stay happened in 2011, I was accepted to a nursing program. I changed my mind about attending during those months. Tragic story, but somewhat of a happy ending. Glad to hear that not only did she survive, but she, although still has work to do, has turned her life around as a working professional, has a kid, so very wholesome. Next story. Myself, at age 25, was sick at home in May of 2020 for 2 weeks. Had visited the ER 3 separate times, and since this was right before Texas got slammed with COVID, they just assumed COVID-related and didn't really do anything for me other than also diagnosing me with strep. The antibiotic I received didn't work. Had bad fevers on and off that eventually stopped breaking. Third ER visit, I checked in at the COVID check-in. Temp 104 degrees Fahrenheit, O2 79%. Normal is greater than 94. Sent to another ER for higher level of care. Septic AF from parainfluenza, pneumonia, strep, and Rocky Mountain spotted fever. Yes, like what the F? Basically went into multiple organ failure. Kidneys got it the worst. I actually went into cardiac arrest shortly after being intubated in ER. Survived all that thanks to dialysis and woke up in ICU 3 to 4 days later, no memory of anything. I actually am an RN and worked in the same ICU a year later, and all my coworkers said they thought I was going to die any minute. Next story. Cardiovascular tech here. I was doubling as a specials procedures tech in radiology when a healthy young man, 20s, who was visiting a friend collapsed in our CCU. He had lost femoral pulses and overall was suddenly very critically ill. We were asked to do an aortic angiogram to define his anatomy, and all arterial access was occluded. We finally got a catheter in his left axillary artery and managed to get a picture of his total aortic dissection that began at his aortic valve, spiraled down, and occluded his right renal and most of his iliac arteries to the femorals. We did what we could to stabilize him and sent him to Houston, where he was grafted and he lived. I saw him maybe 2 years later when he was back at our shop for a checkup. He was scarred from his neck to his knees. A lot of plastic in there. You guessed it, he had an unsuspected Marfan syndrome and it damn near killed him. I never saw anything else close to that much vascular trauma that survived. I wasn't all that aware of Marfan syndrome back then, and now, every time I see long, skinny digits, I remember that guy. Next story. 23-year-old female came in with sepsis after a kidney transplant on the black market. She had been on the transplant list, but had not yet received a match, so I guess her parent decided to take her fate into their own hands out of desperation. Parents wouldn't tell us where they had been to acquire it, but the patient was septic with a strain of bacteria called New Delhi Metallobeta-lactamase, NDM, which, as you can probably guess from the name, was first identified in the Indian subcontinent. This kind of bacteria produces carbapenemus, an enzyme that digests a wide range of lactam antibiotics, including carbapenems, which are basically our last resort of antibiotics for the treatment of infections caused by resistant strains of bacteria. So the patient was being pumped full of our best antibiotics, and this bacteria was simply digesting them. Patient then got a secondary Pseudomonas infection in both her eyeballs and had to have them removed. Pseudomonas is a nasty bacteria and one you don't want in your eyes. Google Pseudomonas keratitis at your own peril. They did sadly die in the end. Next story. I've told this story before. Youngish female, early 20s maybe, around 400 pounds. High-speed MVC. Her car was torn in two and she was ejected around 100 feet. Landed against a telephone pole. When the cops show up, they assume she's dead. Nope, just drunk. Her massive body fat had protected her from pretty much any injury. I think she broke a few bones, but was fine. Also saw an older guy, maybe 60s, who was having headaches. Went to his PCP, who got an outpatient CT scan. He then went out dancing with his wife. Gets a call from the doctor to go to the ER. Guy had a massive subdural with shift, like his entire brain was smushed to one side of his skull. Went to surgery that night. Wife goes, "That's why he was such a bad dancer tonight." Next story. Perhaps a less gory, less dramatic, but my father was the patient. He was getting a lot of tests done for his heart, which had been giving him some trouble. The doctor showed my father the test results, a diagram of his heart and the major arteries, along with how blocked each one was. The best was 90% blocked. The worst was 100% blocked. The doctor says, "Frankly, mister, I'm not certain how you're sitting here having a conversation with me." Quintuple bypass surgery followed. He's still alive 2 years later and got to meet his first grandchild. We keep a copy of the test results around. Next story. Had a trauma guy. Tried to unalive himself with a shotgun, but only managed to destroy all of his suborbital structures, i.e. everything below his brain. His eyes were mostly destroyed, but the remnants were falling down into what used to be his mouth. Other than that, just a bunch of destroyed muscles and ligaments and blood dangling down from his maxilla. To intubate him, we just put the tube directly in what was left of his larynx. You could see the gas bubbling through the blood. Later converted to an actual tracheostomy. Obviously, I couldn't tell how he was doing, but he was thrashing around, breathing really quick, but no longer able to scream because his larynx was essentially destroyed. I think he must have eventually died, but who knows? Next story. Worked in ICU, admitted a guy with dizziness, hooked him up to our monitors, and it was painfully obvious he was in VFib, a lethal rhythm. Normally, people are non-responsive when they get to that stage of heart disease and soon dead. He was awake, alert, and oriented. He looked at the monitor and said, "That doesn't look good, does it? Am I going to die?" The attending internal medicine doctor replied, "Actually, yes." He then passed out and died. We attempted everything possible to revive him, but to no avail. Still, how did he manage to maintain consciousness in VFib? Next story. There is a patient who went to cardiac arrest on the hottest summer days after ODing on cocaine. He was found unresponsive for God knows how long, and a bystander started CPR. When the medics came, they did CPR for 29 minutes, and at the 30-minute mark, they found a pulse. He was taken to the ER, then transferred to the ICU. Once the patient stabilized, the patient transferred to our unit. He was a complete vegetable. The family did not want to pull the plug. He was unresponsive for a total of 8 weeks. Then one day, he woke up and we found him on the floor trying to crawl out of his room. He pulled out his trach, lines, etc. He was so confused and it was so difficult to redirect him. At the time, it was pretty evident he suffered severe brain damage. 5 weeks later, the patient is discharged from the hospital, mind full intact, passed all of cognition testing, etc. The patient told us all the events prior to his heart attack. He said he received a second chance and he wasn't going to F it up this time. I'll never forget that patient. Next story. Probably the craziest patient I had was during residency. Took a call about a patient with a gunshot wound to the center of his forehead, but they said he was talking and just complaining of a headache. EMS said it was witnessed by bystanders and the guy had been shot by a handgun from a range of about 10 feet. Guy shows up, has a crater in his forehead, exit wound in the back, and this weird ridge that's really tender over his scalp. But otherwise he's fine and just says he's sore. Turns out, on a CT scan, the bullet tumbled and basically followed the contour of his skull, and it was all superficial. It's a weird feeling to discharge someone from the emergency department who was shot in the head. Next story. Nad/Nan, okay? So this is about a cat. I can't find the videos, but someone caught a wild cat that was living in a colony, and they wanted to rehabilitate him. They fed him and then bathed him. While giving the cat a bath, it was completely covered in mud. They discovered that part of the cat's intestines were hanging out of its stomach. They brought the cat to the vet, and the vet said that the cat shouldn't even be living at this point because its entire body was septic and toxic, along with the part of its stomach that was hanging out was necrotic. Sadly, they couldn't do anything, and it died soon after. It's weird how much animals can handle. Well, they do say that cats have 9 lives, but losing their intestines, I think that automatically depletes them to 0. Sad story. Next story. My cousin, who's a doctor in our country, told us about a freak accident involving a pregnant patient. She was rushed to their hospital because her belly was pierced by a falling steel rod from atop of a construction site while she's riding a motorcycle with her husband at a normal driving speed. Brought to the hospital with the rod still pierced through her. They had to saw the rod out and deliver the baby immediately after. Luckily, no vital organs were damaged, and the baby was on the right position inside the mom's belly at the right time. Survived and was delivered safely. Next story. Not a doctor, and also not close to death, but I had a little chest pain in the middle of my chest when working once, which kept getting worse. At the time, I was working in a warehouse where I was regularly lifting 10 plus kilograms. It eventually was hurting so much I was crouched over and barely lifting things. My boss saw me and said, "You're in pain. You need to go home and call your GP." And he told a coworker to drive me home. Once I was home, I called my GP, and they didn't think much of it since I said the pain subsided whenever I laid down. They just told me to come in during their walk-in hour, so I did. When I got there, they listened to my breathing with a stethoscope and asked a couple questions and said, "I don't hear anything serious or weird. Just to put your mind at ease, I'll schedule you an x-ray in the hospital. You can head there now and we'll notify you of the results tomorrow." I went to the hospital and took the x-ray and was sent home. As soon as I was home, I hopped onto a voice call and played some Overwatch competitive. A couple games in and I get a phone call. "Hey, this is name from X-ray department of the hospital. There's something not right with your X-ray." So I thought, crap, the X-ray needs to be redone. You have a fully collapsed left lung. Do you have someone to drive you to the emergency room? It turned out I had a hole so big in my left lung. I was leaking 500 milliliters a minute, and I was breathing that whole day with just my right lung. Next story. I'm not a doctor or nurse, but my right lung collapsed. Spontaneous pneumothorax at 2 a.m. during a work shift. I woke up from an hour nap. Yes, I nap at work. Sneezed, and then was like, crap, that hurt, and carried on. I was climbing ladders 100 feet up on columns throughout the night and exerting myself. I had stuff to do. I never gotten a cold or flu, or was too stubborn to realize I was sick in the past 25 years. So when it happened, I thought it was a cold. Everyone over-exaggerates a cold, saying they feel like they're dying. Well, I felt the same, so I just ran with that excuse until 7 a.m. and left work. It started to progressively get worse and worse. Dizzy, wheezing, numb, short-sighted, short of breath, so thankfully I said to myself for the very first time, "Man, I think I should get this checked." I walked into the emergency room and all the staff and patients looked at me in absolute horror, like they've seen a true-to-life ghost. And the emergency room was a little crowded, but I walked in, gave them my insurance info, and just said, "I don't know what's wrong, but I don't feel very good." Then they started talking to me like I was a confused old man and very calmly got a wheelchair for me and was like, "All right, dear, let's go ahead and get you checked out now, okay?" And I'm still like, what the F? I don't need that. Just give me a pill and let me be on my way. I refused to sit down, so they escorted me in the x-ray room with a friend I knew from high school that was the security guard. We caught up for a quick second, and I asked him what the hell was going on, and he was like, "It's okay, dude. We'll get you taken care of." So I'm triage room after x-ray, and then the security guard, 2 anesthesiologists, 2 nurses in full surgery getup, and the ER doctor come in within like 3 minutes, and I'm in fight or flight mode at this time. I'm ready to kick ass or die trying, because they're wheeling in all these tools and stuff, and the doctor immediately starts talking down as I have my hand on my pocket knife. After a couple minutes of conversation and confusion about what's wrong, the doctor was like, "Have you looked in a mirror recently?" I'm like, "No, why?" Turns out my face, eyes, lips, cheeks were completely sky blue from lack of oxygen for so long. After that, I was like, "Oh, I guess you're doing something about that, huh?" And then he asked me what time it happened, and I'm like, I sneezed and felt weird at 2 a.m. It's already going on 9 a.m. at this point, and it was an hour and a half drive back home. So then he starts yelling at me and calling me an idiot. You know how long it takes after one lung collapsing, the other one starts to collapse? First off, I didn't know my lung collapsed, and second off, apparently it's like 7 hours because I'm here now. And then he was like, about 30 minutes, and I'm like, oh, oops. Well, I didn't know. I'm not a professional. So they knock me out, and I spend 12 days in the hospital because it was a rupture instead of just a collapse. They had to repair it. Man, those tubes in my side hurt like hell. And that's when I learned I'm also immune to morphine. Goes straight to my bladder. But that Delia did, though, that stuff hits good. Edit. While they were knocking me out, all I did was text my sister-in-law and said, hey, good morning. I'm in the ER now. Apparently my lung collapsed, so I don't know how long I'll be here. But can you let everyone know I'm okay? Thank you. Love ya. And then I woke up with her, my brother, mom, and dad, all in the room like, what the F happened? I was like, geez, it's not that bad. And then felt the 3 tubes in my chest and was like, oh, well, okay. Maybe it was worse than I expected. Next story. Story one of my ER coworkers told me. Overnight administration. Patient was a college intern in the ER, found unresponsive in the break room. Come to find out, patient's blood sugar was 8 mg/dl. For context, the average level in a person is 140 mg/dl. How did this happen? She ate an orange that had been used to practice insulin injections on. Someone put the orange they practiced on back into the fruit bowl, and the patient basically was in an insulin coma from multiple insulin injections via the orange. Patient made a full recovery, probably because they were young, but that was definitely too close for comfort. Next story. Not a doctor or nurse, but paramedic. During the first wave of COVID in the US, I worked in Queens when it was the epicenter. We'd get inundated with calls, seeing over 6K calls a day, which was 2 times our daily average, and it was nuts. It got so bad we had protocol in place to leave you at home if you weren't that sick. One of the moments that stuck with me about how bad this was going to be was when I got to a 48-year-old woman in her apartment. She called because she felt unwell. My partner and I were shocked at the gall of this woman to call for an ambulance in the middle of a pandemic when hospitals were at capacity because she felt sick. She looked uncomfortable, but otherwise fine. My partner and I were getting ready to deem her safe to stay at home when I decided to put the pulse oximeter on her for a complete vital signs assessment, and she had a saturation of 51%. I didn't think the machine could go that low. I looked at her and she seemed sick, but not critical. I got another pulse oximeter and it had an identical reading. I checked it on myself and my partner and it was in good working order. I put it in all of her fingers and again, 51%. I looked at her again and she was completely alert and oriented with full decisional capacity and a normal work of breathing. Lung sounds were immaculate. I almost crap a brick. Most healthy people with no pulmonary issues have severe altered mental status and confusion when their saturations are in the high 80s. She was hanging in the 50s, with supplemental oxygen via a mask I got her as high as 84%. This woman, for all intents and purposes, was cognitively at her norm and looked as if she may have had a stomach bug, but in reality, she was beyond hypoxic and critically ill. We knew nothing about COVID then and seriously debated intubating her, but seeing how comfortable she appeared and how she wasn't working hard to breathe, we decided to leave her be and just transport her to the hospital. I started an IV on her and it scared me to see the hub of the angiocatheter, the plastic holder of the needle I used to start an IV, fill with the darkest blood I'd ever seen my entire life. It looked like chocolate syrup. It was then I realized we were in serious trouble and this was just the beginning. That oxygen saturation in conjunction with other signs, symptoms, and story would ultimately be the big indicator at the time of how sick you were and had a high degree of success in indicating if you had COVID. The lowest saturation I'd eventually see in a COVID patient would be in a 32-year-old guy who met me at my ambulance. I mean, he literally walked to my truck with a saturation of 42%. He looked like he felt crappy, but again, nothing about his appearance screamed he was dying inside. It's been 2 years almost, and I'll never forget.